should be expected to endure. As a doctor working in an emergency department, I'm witnessing a level of suffering that is indescribable. We're dealing with nowadays two overwhelming realities: the mass casualties, the children, women, men, and elderly being bombed, shot, or even choked to death by tear gas. And second, the total collapse of our healthcare system. Just 2 nights ago, I was caring for three children aged between 13 and 15. All of them had gunshot wounds to their abdomens. They have undergone surgeries. Um, and one of them developed cardiac arrest and died. We tried to resuscitate him for 1 hour, but sadly, we didn't have the medications we need to even make him survive long enough to go, to go through the second surgery. We couldn't. And the other child developed sepsis due to the um, poor hygiene, the situation of Nasser Hospital, and we couldn't provide them with the antibiotics that he needed. The antibiotics we have are either expired, ineffective, or in critically short supply. And this is a common pattern now. We're not just losing lives due to trauma, we are losing them because we cannot provide basic treatment to them. At Nasser Hospital, we're just barely functioning. We don't even have Tylenol, hypertension medications, or even the simplest antibiotics. For every patient, we have to argue and convince ourselves why this patient deserves this one remaining vial of a drug. And that's just very difficult to decide or to figure out. Imagine being forced to decide who gets simple pain relief and who doesn't. And that's a reality here in Gaza. And it's just not trauma. We're seeing a sharp rise in cases of acute flaccid paralysis. It could be due to either to food poisoning, or it could be due to a severe reaction to a previous simple infection, like a sore throat, like a simple diarrhea. Everything is fine for a few days, then their legs become weak, their arms, and eventually the respiratory muscles, they stop breathing, and we have to intubate them to get them to the ICU. But our ICUs are full. They are beyond full capacity, and they often lie outside in the corridors without even a proper bed, on the floors, waiting for care that never comes. Some of us suspect what we call Guillain-Barré syndrome, but even though we don't have the proper medications for it, what we call an intravenous immunoglobulin, and even the little amounts that we manage to administer to these patients, it only works in 30 to 40% of cases. And we're working on some big paper, really. It's very grim. And then there's the story of a child that I've been taking care of for almost 2 weeks now. He inhaled gas while trying to get aid from the so-called the Gaza Humanitarian Foundation, the Safe Reach Solutions centers, very crowded. And one of the soldiers decided to throw away a tear gas, and about 20 choked, and he was one of them. He developed what we call brain anoxia. His brain, he couldn't breathe for long enough that his brain cells died. Like 3/4 of his brain are just dead. And he's just essentially paralyzed in 4 limbs, developing seizures every day. And his parents sit by his side every day. And just think about not only this story, but on the scale of thousands of children being injured, being just their parents looking at them, and even some of them don't even have their parents. The parents were killed, and there's no one to take care of them. Think about it in a scale of 2 million Gaza citizens. Emotionally, this is draining, and physically is just very destructive. We're collapsing. We often go days without any food. Clean water is a problem here. A lot of us develop diarrhea, gastritis. We're vomiting a lot. We're losing a lot of weight. And we don't sleep enough because there are barely any doctors to cover the huge amounts of patients coming in. But we try to keep showing up because there's no one here for these patients. You know, internationals come here for 2 weeks and then they leave, and it's not a very meaningful amount. We're talking about like 40, 50 in each mission. It's nothing, you know. And yeah, and at this point, there's no real aid coming in really for months and months. There's no medical supplies and no food, no fuel, and no functional lab equipment. At this point, we are even trying to prioritize who gets a simple blood test like a CPC or some electrolytes. And these are essential for basically every patient. And we try to treat patients without any diagnostic data, almost blindly. It's barely working. We're losing a lot of patients due to that. And as an ending statement, what is happening here in Gaza is just not a humanitarian crisis. This is, by everyone's standards, is a deliberate dismantling of life. And we are trying here to keep people alive using empty hands, just a stethoscope, just some sense, and that's it. We're just waiting it to get better or to just end. Thank you.
Thank you, Dr. Marjad. Thank you. I will now go to Dr. Lina Qassem Hassan, who is the chairperson of Physicians for Human Rights Israel, PHR, the board of directors, and a specialist in family medicine. Hello, Dr. Lina.
Hello, Cynthia.
PHRI recently published a report on the genocide in Gaza. Could you share more details about the findings and also speak on the current situation of Palestinian healthcare workers in unlawful detention, as well as the conditions in which they're being held?
Yeah, sure. Thank you, Cynthia, and thank you all for being with us today. My name is Dr. Lina Qassem Hassan. I'm a family physician and I'm the chairperson of the board at Physicians for Human Rights Israel. I'm speaking today as a Palestinian, first of all, as a medical professional, but also as a human being and member of an organization that brings together Jewish, Israeli, and Palestinian colleagues in a shared commitment to ethics, justice, and right to health. As you mentioned, PHRI has recently released a report that documents the deliberate and cumulative dismantling of Gaza's health system, and with it, actually, the people's inability to survive. The report has concluded that this amounted to genocide. Israel's bombing of hospitals, targeting medical personnel, destruction of medical equipment, and depletion of medications made medical care both immediately and on long term virtually impossible. The system collapsed, as we heard from our friend Dr. Jaber, under the weight of relentless attacks and blockade. I would like to focus today on one horrifying and underreported aspect of the genocide in Gaza: the mass arrest, detention, abuse, and forced disappearance of Palestinian medical personnel. Targeting Gaza's medical workers is a pattern of systematic destruction. This didn't start by accident, and it is not isolated, and it is not just a byproduct of war. We have documented in meticulous detail a deliberate and systematic campaign to dismantle Gaza's healthcare system, and at the center of this campaign has been the targeting of its medical personnel. It began with the raid on Al-Shifa Hospital in December 2023, when Israel arrested scores of staff, including the hospital's director, Dr. Mohammed Abu Salmieh. But it didn't end there. There were repeated assaults on hospitals, Al-Auda, Kamal Adwan, Nasser, and a second wave of arrests at Al-Shifa on March 2024. And in the same year, also on October and December, we saw renewing of the raids on Kamal Adwan Hospital, when the Israeli forces kidnapped its director, Dr. Hussam Abu Safiya, who is still held under solitary confinement in terrible conditions in the Israeli prison. These mass arrests, what happened is that they devastated actually Gaza's already fragile healthcare system as part of a broader strategy to destroy Gaza's medical infrastructure. We're talking about more than 300 doctors, nurses, and paramedics that were arrested in total. As of today, over 100 remain in detention, including 25 physicians, more than 50 nurses, and 30 paramedics. Not one of them, it's very important to highlight that, has been charged with any crime. 4 medical workers have died in Israeli custody, and their bodies are still being withheld. What we in PHRI collected through direct visits, testimonies from detainees among medical personnel, and we found a clear and horrifying pattern that has emerged. Palestinian healthcare workers describe ritualized abuse at every stage of detention. Upon arrival, a new facility, they endure what detainees call the welcoming, at-tashrifa in Arabic, which is a brutal, systematic beating meant to humiliate and break the spirit. They are often subjected to sleep deprivation and sensory torture in rooms known among detainees as the disco, flooded with deafening music and blinding lights between interrogation sessions. They are starved, they are denied medical care and subjected to torture that includes physical, mental, and sexual violence. Some doctors with chronic conditions denied access to clinics and medication. One detainee told us that when he appealed to the prison doctor, reminding him that they are both physicians, they are their colleagues, the doctor slapped him and called him a terrorist. At Sdei Timan detention camp that we all heard of, amputations after prolonged shackling were reportedly carried out without anesthesia. That is not only a war crime, it is a perversion of everything our profession and our oath stand for. And I want to mention here that the most shocking thing is the role of the Israeli medical institutions in all that. When international association called the Israeli Medical Association to condemn these practices, the IMA did not just remain silent. They labeled the detainees among medical personnel as terrorists. And this rhetoric has justified the dehumanization of Palestinian medical professionals, even as they were beaten, starved, and denied treatment, as we heard before. So I want to be very clear again. None of these healthcare workers have been charged or even convicted in any crime. This is not about security. This is about eliminating Gaza's ability to survive, to heal, and to rebuild. This is not collateral damage. This is genocide. We are here today because silence enables atrocities, and because these doctors, our colleagues, are suffering only for doing exactly what we have all sworn to do, to provide care, even in the most impossible circumstances. The attack on Gaza's healthcare system did not end with bombing hospitals. It continues through the walls of Israeli prisons. We saw that in our eyes. Every hour that these healthcare workers remain detained, another hour that Gaza is deprived of care. It's another hour that healing is delayed and suffering is prolonged. Thank you.
Thank you, Dr. Lina. Dr. Mohammed Mogaisib is next. He is the Deputy Medical Coordinator for MSF in Gaza. With degrees in medicine and mental health, he has worked with MSF for nearly 23 years. Welcome, Dr. Mohammed.
Thank you first of all, thank you for having me in this press briefing.
Thank you for being here. So we have seen media reports suggesting that the Gaza Humanitarian Foundation is planning to expand its operations in Gaza. At the same time, MSF and over 200 other humanitarian organizations are calling for it to be dismantled. MSF also just released a harrowing report detailing the mass casualties you've been treating from incidents at GHF food distribution sites. Could you walk us through some of the key findings from that report and share your own thoughts on what it means that GHF is expanding instead of shutting down?
So, first of all, I thank Dr. Majid and Dr. Lina for their really comments, and I will come back to this. But I mean, since GHF opened their activities in May, I mean, we started seeing a lot of patients in our facilities. I mean, we have several clinics in Gaza. We have field hospitals run by MSF in Gaza. So we started to see patients coming from there. I mean, instead of, people going to pick up their food aids and things, they are really shot. And we have a clinic actually very close to one of the distribution points in the south here. And we received more than 1,380 patients since the 7th of June. And, 28 came dead. And we have a stabilizing unit, actually. I mean, the clinic is a primary health clinic, but because of what's going on in this distribution points, we established a stabilizing unit to stabilize the patient at least and refer them to the running hospitals like Red Cross Hospital and Nasser Hospital in Khan Yunis. I mean, most of the cases are gunshot, of course, injuries. I mean, 11% of them, they had gunshot in the head, 19% in the abdomen and thoracic, and the rest actually in the lower extremities, upper extremities, limbs. I mean, 71 of these cases were children under 15 years old. So, I mean, and the youngest we had was a girl of 8 years old. So, instead of, we are calling to really to close GHF. I mean, because actually it's not a distribution aid, it's really death trap. And I mean, even if they are planning to expand to 16. I mean, before this, I mean, the Gaza needed 400 distribution points, and it was barely coping to distribute to the population during this war by the UN. We have a health system that before 7th of October was a fragile health system in Gaza. I mean, we have to stop saying that the health system had collapsed in Gaza, actually, or collapsing. I mean, now I'm saying that there is no health system in Gaza. I mean, the health system which is existing now is working on a daily basis. And here I'm speaking about the structured hospitals like Nasser, Shifa Hospital, Al-Aqsa, which are the structured hospitals. I'm not speaking about the field hospitals run by the international NGOs. I mean, they are barely functioning on a daily basis. I mean, now the hospitals are overwhelmed. Nasser Hospital, we are supporting Nasser Hospital. The patients are in the corridors, as Dr. Majid mentioned. I mean, patients literally lying in the corridors, patients waiting in the emergency department to be seen by doctors. Patients are waiting in queues to enter the intensive care unit, to have a bed in the intensive care unit. Patients in queues to have to be operated in the OT, I mean, operating room. There is no space for them. The hospital is really, I mean, it's overwhelmed with the patients that are victims of the airstrikes, and now with the GHF and the distribution points, it's really cool. It's a disaster inside. I mean, of course, the doctors are completely exhausted. I mean, the doctors and the health workers are part of the population. I mean, they have acute hunger. I mean, since March, there is nothing entering to Gaza. I mean, just a few days now, the market is, you can see a little bit improvement. But I mean, there is an acute hunger, and the health staff are part of the population. They are coming, they are eating one meal, they're exhausted, they are working since 671 days of this war. I mean, they are totally tired, burned out. And as Dr. Majd mentioned, I mean, we cannot have, I mean, there is limited access to international people to enter, I mean, to enter to Gaza to support. And I mean, the situation, I mean, to be honest, I cannot really describe it. I mean, we reach now 61,000 people killed, among them nearly 18,000 children among the victims. That's really have to stop. And I mean, it's really sad to come to have this briefing in this press today. I wish that I had this press briefing when the ceasefire and the stop of war to come to speak about really good things, not disappointing things. And
yes. Thank you. Thank you, Dr. Mohammed. Rana Soba joins us now from North Gaza. She is Med Global's nutrition officer in North Gaza. She co-manages Med Global's nutrition stabilization centers inside Gaza and has worked extensively at Kamal Adwan and other hospitals throughout northern Gaza. I believe she will be keeping her camera off because I think the reception is so poor. Welcome, Dr. Soba.
Hi, everyone. Um, okay, thank you very much for having me with you today. And actually, I tried to my best to join you and to be in a place with relatively stable internet. Okay, let me begin with something.
I'm sorry, Dr. Soba, I had a question for you. I'm so sorry. Let me ask you
Okay.
the question. Sorry, forgive me. Dr. Soba, for media and NGOs to northern Gaza is even more limited than in the south and in the center. As a nutritional expert, you have been treating and observing malnutrition throughout the crisis. What has your team in the north observed? What are you able to do to help those suffering from severe acute malnutrition?
Actually, since the beginning of the war, I have not evacuated to South. I stayed in North Gaza. I have lived through everything, the bombing, the starvation, displacement, and unbearable fear. I lost a member of my own family. Um, as nutrition experts, or what I have about expert here in North Gaza, I have continued working throughout this crisis, trying to treat malnourished children and support the pregnant and lactating women under the most unimaginable condition. You know what's happened in North Gaza. What I have witnessed beyond alarming, we are seeing sharp and dangerous rise of severe acute malnutrition, moderate acute malnutrition, for children under 5, especially here in North. And some of the children we see are so weak, they cannot walk, laugh, play, sit, or even cry. They come with infection, diarrhea, skin condition, and severe dehydration and other
please do not yell at my older brother Ahmed. 6 months later, Rasha's house was bombed again, and she was killed. Her and her brother Ahmed. I mean, these are the things that are happening to our most vulnerable populations. These are the things that the healthcare workers have to witness day in and day out. And somehow we expect them to maintain some degree of sanity. I think that's absolutely absurd. I think it's time for us, the international community, all of these NGOs, every single government that is watching what's taking place, it's time to call for an immediate ceasefire. It's time to hold the Israelis accountable for the red lines that have been crossed. It's time to make sure that these hospitals maintain the protected status they deserve under international humanitarian law. And it's important to remember that this is a society that has been traumatized for 22 months. How do we support them with everything that they need? How do we serve as resources? How do we stand in solidarity with them? Those are the questions that we have to ask ourselves when we want to figure out how do we support the people of Gaza. It's not just saying, oh, they're hungry, it's time to give them food. I mean, it doesn't work like that. This is a very dignified people, a very well-educated society. It's important that we allow them to function, to heal themselves, to stand up, and that's the role that we need to play. Finally, I do want to recall, Dr. Hussam Abu Safiya and the sacrifices that he's had to make. Director of Kamal Adwan, a pediatric hospital in the north. In one of his final interviews before he was abducted by the Israeli military, he said, I lost everything. I lost my son, Ibrahim. I lost the hospital that I helped build. And now he's lost his freedom. I think we can take an opportunity to call for his release and the release of all the other doctors. We can ask foreign leaders, remember from the United States, we do have a large congressional delegation in Israel right now. I hope that I call on them to visit Dr. Hussam while he's in an Israeli dungeon, to check on his status, to make sure that he's okay. So with that, I will stop there. Thank you.
Thank you. Thank you, Dr. Thayer. So now we will open the floor to questions. And as a reminder for you all, please, for the Q&A portion of today's discussions,